Good afternoon, everyone, and welcome to the Our Doctors versus the Internet Facebook live chat. Today, we're going to be having a conversation about going to the emergency room during the COVID-19 pandemic and also how infectious diseases like COVID-19 work. I'm Prescott Stokes III, the Integrated Content and Marketing Manager here at the TCU and UNT HSC School of Medicine, and I'm here with Dr. Joanna Luke.
Hi, how are you?
Hi, Dr. Luke is an emergency medicine physician at Texas Health here in Fort Worth, and I'm also joined by Dr. Nikhil Bayani.
Hi, how are you? Good afternoon.
All right, thank you for being with us, Dr. Bayani. Dr. Bayani is an infectious disease physician with Texas Health as well. Dr. Luke is an assistant dean of curriculum at the School of Medicine, and Dr. Bayani is an assistant professor at the School of Medicine. Now, both of the doctors will be answering any questions you have for us. All you have to do is just jump into the comment stream on our Facebook Live, leave your question, and we will get you some answers. But before we get to those questions, Dr. Luke, I want to begin the conversation with you. So for patients who feel like they might be having COVID-19 related symptoms, what can they expect when they visit an emergency room right now?
That's a great question, Prescott. So we have all, at all the hospitals across our system, have been working really hard to get ready for this pandemic. And so you might notice some changes when you come to the emergency room, but it really is all for your safety. So one of the things you might notice is that process may start even outside of the emergency room, where we start to gather information because we've actually set up our emergency departments to have areas for patients that are experiencing symptoms of COVID-19, as well as for patients that are not, and they're separated. So we want to make sure we get you to the appropriate area. You're also going to notice that everyone on the healthcare team is going to be wearing masks and even potentially other elements of protective equipment. Again, that's for your safety. But it's going to look different. It might feel scary, but just know it's the same providers you've always had, just with a different look.
And so if someone comes in and they actually have COVID-19 symptoms, what should they expect as far as how their stay at the hospital might be?
Would you just repeat that one time for me?
Yeah, I said for patients who have COVID-19 symptoms, once they get to the ER and it's confirmed, what should they expect for their stay at the hospital?
Oh, thanks, Prescott. So there's a couple different ways that may play out. So the good news is that for most patients, even if you have COVID-19, most patients will actually be able to go home, or even potentially won't need to come to the emergency room. You're not going to feel good. You're going to have fever. You're going to have cough, but you're going to be safe. Now, if during your stay we find that your oxygen levels are too low, or there are other reasons and you need to stay at the hospital, we're prepared for that as well. I will also say, be patient with us. Everything is taking a little bit longer, but again, it's only because of all these extra precautions that we've put in for your safety.
Right. Exactly. Makes perfect sense. Dr. Bayani, I want you to kind of jump into this conversation as well. So although we know death tolls from infectious diseases like the Spanish flu, smallpox, malaria have decreased in recent years, infectious diseases have always been a part of our human history. So how serious should Americans and Texans and everyone in the Dallas-Fort Worth area take COVID-19 and social distancing measures right now?
Right. So this is social distancing and shelter in place is definitely very important, especially when you have a novel virus like this and there's no vaccine. The best way to come out ahead and prevent the spread is by practicing social distancing, shelter in place. And the perfect example is when you go back in history, look at the 1918 Spanish influenza epidemic. The cities that practiced social distancing and limited social gatherings had fewer cases than the other cities that had parades because it was World War I, sending off their soldiers. Those cities were affected.
Right. I think another question that we actually have gotten each week that we've done these live chats is about mutations. So since you work on the more science side of infectious diseases, can you just kind of explain to us if there's any information that COVID-19 might be changing, and just how do mutations happen in viruses in general?
Right. So the perfect example, and this is an analogy, I don't know how well it correlates. It's like, having a new outfit every day with the virus. So for example, the influenza virus, why we have a new vaccine every season, it's because the influenza virus changes for that season. And the strain that we have this year probably is different from the prior years. With COVID-19, this is a new virus. We really don't know what direction this virus is going to take, but if this is going to be a seasonal virus, it might be just safe to assume that, this virus is going to be mutating, every season. And that's why having a vaccine is going to be vital.
Right. When you think about mutations and just even the idea that the virus could be with us and something that we just learn to live with, like the flu, as you gave it as an example, how can we be more mindful about, spreading these infectious diseases going forward, understanding that?
So being mindful, of course, respect what our governmental agencies like the CDC says, wear a mask in public setting. The most important thing is hand washing. I know when COVID-19 came out, all suddenly now there's a big campaign for hand hygiene, but I'm sure Dr. Luke can chime in. We've always been telling our patients that it's very important to wash your hands. If you're going to wash your hands using, soap and water, sing happy birthday to yourself. Simple as that. So simple things help prevent infections.
Right. And Dr. Luke, if you want to chime in just as far as what you guys might be telling people when they come into the ER about COVID-19 and washing your hands, 20 seconds. I know we've been hearing that a lot in the news, wash your hands for 20 seconds. I know you guys have spread that message for a while, but is it still something that just remains important regardless of how this continues to develop?
Yes, and I would even go a step further and say that really for everyone watching this, you are the front lines for us. People keep saying, how can I help? You can help by doing these practices. You are the ones that are going to keep your community safe by social distancing, by washing your hands for that full 20 seconds, by being very careful when you cough, not to just cough into the air. Those are things that you can do that truly help, and we really appreciate.
So, Dr. Luke, I have another question for you, and I want to let everybody know that feel free to ask any questions you have related to emergency medicine, COVID-19. Dr. Luke is here, Dr. Bayani is here, and we can get you any answers that you need. So just jump in the live chat and leave a comment, and we'll get you some answers. But Dr. Luke, what I want to kind of shift a little bit to is when COVID-19 patients are cleared of their symptoms, if they had to stay at the hospital for an extended period of time, when they return home, is there anything that they should be concerned about or mindful of?
So that's a really good question, Prescott, and something that I think is important for us to all remember, that even the tests that we're using, they're getting better every day and they're still not perfect. So if you came to the emergency room to see me, you have a fever, you have a cough, and we tell you your test is negative or that you're safe to go home. If you have a fever and a cough, even with a negative test, up to 30% of those are false negatives, which means you might still have it. And so what we've been telling patients is that if you have those symptoms, you need to just assume that you have it in the way that you interact with others, meaning, isolate yourself, try to stay, keep the 6 feet away from other people, do all the things that we've just been discussing. But just because the test was negative actually doesn't mean you don't have it. And as mentioned, these are just good practices anytime, that you're sick.
Right. Dr. Biani, can you talk a little bit just about vaccines? You kind of mentioned it a few minutes ago about working on vaccines and developing vaccines. Working in infectious diseases, I know that is part of what you all do, try to come up with vaccines and cures. Can you just kind of give us a general idea of what that process is like when you have to develop a vaccine for something like COVID-19?
Right. So, of course, first of all, the vaccine trial is underway for COVID-19 and usually can take up to at least 12 months to have the vaccine available to the public. And, what goes into vaccine development, and this is very typical, and I'll use the example of the influenza vaccine. The influenza vaccine that will be made available to public this fall, they've been studying that a year before. So in the third and fourth quarter of 2019, what virologists do, researchers do, they look at how the influenza activity has been around the world. And what I'm guessing, if we are assuming that this COVID-19 is going to be with us and is going to be a seasonal virus, the same approach will be taken also. Looking at how this virus acted in various communities.
Can you tell us just a little bit about making sure that it's safe for public use? What is that process like? Like as physicians coming up with these vaccines, what are you looking for to make sure this is something that everybody can use and everybody should be fairly safe if they use it?
So that's the purpose of the clinical trials. When they start enrolling humans into these trials, they want to look at, the safety and, of course, the efficacy of the vaccine too. Do the benefits of the vaccine outweigh the risk? So this is where it's, you get your large group of folks who are in these trials. You look at, okay, how many number of people do I need to treat in order to prevent this infection? And that's how they derive the benefits of the vaccine.
Right. And once you understand what the benefits can and it's approved and it's safe for use, what do physicians want us, the public, to understand about how our life might be, even if the vaccine that's created works? Will things still be different? Should we be mindful of certain things? And also, I'm also thinking about stigma. How do we kind of make sure we don't carry some sort of stigma to other people who may have had COVID-19 and have recovered?
Right. So, one thing here is that just like we have the influenza virus, just like we have the COVID-19, even though we have a vaccine, let's say a year from now, we have a vaccine for COVID-19, still you want to be mindful to others. If you are still sick, you still want to practice social distancing, cover your mouth when you sneeze or cough, hand hygiene, same thing applies. Because, always we get the sense of security, okay, I'm vaccinated, I am protected. Yes, to some degree you are, but there's always a small chance that you could have a minor illness. And of course, we know that with the influenza vaccine. And in terms of the stigma, having COVID-19, I'm hoping that there is no associated stigma. The only stigma that I've heard, a lot of the people who do not think, carefully, they think that this is a disease that has limited only to the Asian population. That's the stigma, and that is totally unacceptable. This is a respiratory virus. It's seasonal. It's there. And we just have to be mindful to others by doing our due diligence, as Dr. Luke said, that the patients are the ones on the front line, the people, the community. Do your part. Wash your hands. If you are sick, wear a mask. And even during the flu season, whenever we have visitors coming in the hospital, we offer them a mask because we don't want them to share their germs with everyone else and make everybody else sick.
We also have a question from our chat, and I want to thank everybody for watching with us and leaving questions. You can feel free to jump in the comments and ask any question you would like about COVID-19. This question, I think it's for you, Luke. It's from Dione Aglin with Fox 4 News. Thank you, Dione. The question is, how is it determined if a presumed COVID-19 positive person should indeed be hospitalized?
That's a really great question. and I can speak for my emergency department I work in, but know that hospitals across the city are practicing in a very similar way. We're looking for a couple key things. We want to make sure, first of all, as mentioned, this is a respiratory illness, so the main thing that we're looking at is how you're doing on breathing. And so you're going to notice as a patient that we put you on a monitor and that we're very closely watching your vital signs and especially the level of oxygen that you have. And so if that level is above 92%, so that's the first thing, and you are able to have a safe place to go where you can isolate and you don't have, other symptoms or other disease processes that might get you admitted to the hospital anyway, we're going to let you go home. Now, I'll say again, you are not going to feel good. I mean, even at home, you're going to have a fever, you're going to have a cough. This thing takes up to 2 weeks for you to start feeling better. But the reason that we would keep you at the hospital would be to really provide oxygen, because that is the only thing that we've seen that has helped patients. There is no other proven therapy. So there is right now no medication. There's nothing else that we can do in the hospital for you except give you oxygen. And really the hospital, while we're there to help, you are safer at home. If you can stay home, you are safer there.
Good information. We also have another question for you, Dr. Luke, as well. And the question is, if I'm pregnant, should I go to the ER? And the second part of the question is, what should I do if I have problems with my pregnancy right now?
Well, again, just know that we're here, for you and your baby. So I would say, if you have any kind of symptoms, the first stop should be calling and talking to your obstetrician. Our local obstetricians have done an amazing job, and really even before the pandemic, of having triage lines that are staffed 24/7. So if you are able to, that's the first stop, because they'll be able to tell you kind of where to go next. Now, if you're experiencing symptoms of shortness of breath, a fever, of something that you think really needs to be seen in an emergency room, don't hesitate, come see us. I know it's scary, but again, we're there for you and have put all kinds of precautions in place to keep you and your baby safe.
And Dr. Luke, can you talk just a little bit more about the rest of medicine still happening while we're currently in the COVID-19 pandemic? Each physician that we've had on each week has always kind of preached that message that, people there's still minor injuries, people still have doctor visits, and other things are still happening. And you shouldn't be afraid to go to the hospital if you feel that you have a serious concern, right?
Yes, I agree, Prescott. So again, we have set up our triage to make sure that if you come in with symptoms that do not seem to be related to COVID-19, that we actually are able to put you in rooms in a separate part of the emergency department. Again, it's our own version of social distancing. We're trying to keep you as safe as possible. And we want to be there for your emergent conditions. And I'll again say, our local community physicians outside of the hospital, outside of the emergency department, have just stepped up so many ways. And through telemedicine and other services, your doctor is still there for you. Don't hesitate to contact them, and they'll be able to give you more information about what they can provide.
Dr. Luke, another thing, and Dr. Biani, you can also chime in on this as well. Just for you all as practicing physicians, you guys are on the front lines every day when you go to work. What kind of precautions are you all taking to make sure you all remain healthy and safe to be able to provide treatment for others?
Right. So the most important thing, of course, whenever we're approaching a patient care area, we are wearing a mask. And of course, if this is a patient who's on the floor or on the unit that is a so-called COVID unit, where all the patients with COVIDs or with their test pending, we have very specific personal protective equipment we have to wear into the room. And of course, the mask that we're wearing in the hospital, we have to take off and put on a new mask every time we enter a patient's room. And we have face shields also.
And Dr. Luke, is it the same process for you all in the emergency room?
It is, and it's something that we're thinking about constantly, of being so careful, when we put on that protective equipment, that after we come out of the room, being so careful when we take it off to not contaminate ourselves. I think it's hard for everybody, but things like not touching your face, and then just normal things to do to be healthy, right? Like get enough sleep, drink lots of fluids. Those are all things that are going to keep us on the front line.
And Dr. Luke, can you, and Dr. Bayani, you can answer this one as well. We've seen like a lot of videos over the last few days of physicians and nurses explaining to people about wearing gloves going out in public and the face mask, how to properly dispose of them once you're done and not to constantly touch things, even though you have gloves on your hand and you're thinking you can just go around, touch things, put things
Right.
back. The germs are actually still there. So can you at least just speak on the importance of what's actually happening, even though you have on gloves?
Right. So exactly what Dr. Luke had mentioned, that the biggest challenge is when we come out of the patient's room, we have that, of course, instinct, oh, let me touch my face. But with the gloves, you know, shown us a technique that you want to get your finger inside. Don't touch the outside of the glove as much as you can, and remove the glove. And then after we do remove the glove, we have to use an alcohol-based hand sanitizer or wash our hands. And then we take our gowns off, wash our hands again, and then we step out of the room and take our mask off, making sure we don't touch the outside of the mask, rather we handle it from the threads around our ear. So it's a process.
Right, right. We do have some questions, so I want to get to some of the questions in the live chat. Thank you guys for leaving questions for our physicians. So the first question, either one of you can answer this one. Has the Dallas-Fort Worth area reached the so-called peak? And if not, when will it be? I know just watching a lot of the newscasts, people are saying like the next 2 weeks, you shouldn't even really go outside to get groceries unless it's extremely important, just because we might be reaching that peak. Is that something you all have been hearing about at the hospital?
That's what we've been hearing here, and looking at, of course, the numbers around the country. You know, of course, the Metroplex is a less dense population compared to New York City and New Jersey up in the Northeast. So at least we have not hit a peak yet. Is it coming? Just as what you just said, Prescott, at least the next 2 to 3 weeks. It's worth keeping an eye on.
Right, right. Also, we have a question about PPE. Our students actually have a PPE drive going on right now that's going to last until the 20th. People can stop by TCU's Frog Alley and make donations, or they can send them an email, mdppe@tcu.edu. But the question is also just about the shortage. We've been hearing so much in the news of hospitals experiencing shortages of PPE. And Dr. Luke, since you're in the emergency room, what has your experience been as far as having enough PPE to make sure everyone can stay safe and treat patients?
Well, I want to first start by just thanking our students for doing this drive, and for every donor. I mean, it literally, to me personally, feels like a life-saving gift that you're giving. And it actually goes back, Prescott, to your question about the gloves, right? This PPE is intended to really be single use, right? We go and see a patient, and then all of that needs to be discarded. So you can imagine, as our volume of patients goes up, our use of these materials also goes up exponentially. I will say that our hospital systems are doing a great job keeping an eye on this. We get updates often about kind of where we are and where the supply is, but every bit helps. And it's not just for the large hospital systems, you know, urgent cares, places that are still seeing patients, but maybe are not associated with a large system. They're running out, and you cannot, you know, you can't really buy it anywhere because everyone across, you know, the country and even the world have the same need. So if you have masks, gloves, gowns, anything you can donate, I'll say again, very personally, it really could be a life-saving donation.
And Dr. Luke, the other thing is emergency rooms are typically stressful in general, right? Because people are coming in with serious injuries, right? Outside of the COVID-19 pandemic. So one of our questions was just wanting to know how are physicians handling the stress? Are there any sort of techniques for people who work in healthcare that you might want to share with them to just kind of help them be able to manage the stress throughout this pandemic?
Well, I think the main thing is just to really, even though we're physically distanced, to not actually be socially distanced. So it's to keep those connections. It's trying to find who is it that you can just really talk things out with after a hard shift. And also just not being afraid to admit, like, this is really scary. This is really hard what we're doing. And it'll take a long time for us to ever feel like things are back to normal. But I will say, Prescott, people have come out of the woodwork with just support for healthcare providers. And not only that, but really all the people that are still doing these essential jobs. So really the community is what I would say is really helping with my.
Right.
How about you, Dr. Biani?
No, very true. I mean, definitely, it's going to take some time before we reach normalcy again. And really, the community has been very supportive. And I do appreciate, I received the emails from the TCU School of Medicine and really praised the students in, collecting PPE for the frontline, the healthcare workers and the first responders.
I think the other part of that is sort of stress, on the job when you guys go into work and try to help treat people and get them back healthy and everything. But when you go home for like your own families, you guys have to deal with that kind of stress, and your families are worried every time you go outside to go to work. For other people working in healthcare, is there a message you can kind of send to them as far as the family element and how to deal with managing that part of the stress?
I think it really just points out that it's not just us on the front lines, it's us and our families. I will say I've made the personal decision that I'm actually living in an apartment for now just to make sure that my family, is not exposed to this. And that makes it even harder. And so thank goodness for things like FaceTime, to still see my, small children that are at home with my husband. But it is, I would just say, to keep talking, to be honest with your kids, and then to find things to do that have nothing to do with this, to watch a movie together, to do things to really be able to focus on something other than this pandemic, to turn off the news every once in a while.
That's exactly true. I mean, the most important thing is spending time with the family. And of course, a lot of healthcare workers are, staying, away from home just because they want to keep their family safe. And that's very important. But come home, just watch a movie, turn off the news that's pertaining to COVID. Unfortunately, there's no sporting events, so thank goodness for ESPN to show replays. That's how I unwind usually.
Right. No, I completely understand. I'm a sports guy as well. I just had to relive my Saints on Monday. ESPN played the first game back.
I saw that Monday night game.
Yes, I was actually there. I was physically there when it happened.
It was the game after Hurricane Katrina in the Superdome.
Yes. But I do have another question that I want to get to you guys before, we wrap up, is about shelter in place. So have the shelter in place orders kind of reduced the workload on healthcare providers, or at least in our area, Dr. Luke? Is that something that you've seen in the past few weeks?
I really think so, Prescott. And I think that actually circles back to the question about, are we at peak? We are not at our peak yet, even close, but I think it's coming. But that date keeps moving back, and that's the curve. So as the further back that we can push that peak so that we can be prepared and have more resources to meet that need when it comes, that's the whole point. And our community, as every time that date moves back, that means the community is doing, what we've been asked to do. So yes, and keep going. It's hard. Like, it is really hard to shelter in place. I'll say again, you guys are the front lines doing this hard work, but keep doing it because we need you to, our community needs you to.
Right. Totally agree about that. And, that's the way we're going to keep pushing, or so-called flatten the curve, as they say, because, doing our part, shelter in place, it is the hardest thing anyone can do. You definitely can go stir crazy, and, there's all sorts of stuff, other personal issues too, but this is the most important way in not overwhelming the healthcare system and keeping people safe.
Right. And that's what we want to do. That's the reason why we have these chats every week. We do have another question that just came in, and this question actually is from Fox 4 as well. So the question is, a city official made mention of this particular phrase called Easter +5. And what that actually means is if people don't strictly practice precautions on Easter Sunday, which would be no gatherings, we could possibly see a significant spike in cases in about the next 5 days. So when you guys are kind of estimating, peaks and, the going up and down as far as patients are concerned, do you agree with that? Is that something that you all have to consider?
Yeah, I would say that's part of, what one of the scariest parts of this virus is, right? Is that you can be contagious and have no symptoms. And so those gatherings, and it could even be as long as 2 weeks down the road, that's when we're actually going to see the really sick patients, even if you caught this, disease on Easter Sunday. And listen, I know, spirituality is part of wellness, and that's so important to people. And it's just, we're just gonna have to find ways to practice that virtually to keep our entire community safe. But please don't let Easter be the reason that we don't flatten the curve or that our peak is higher than it needs to be.
Totally agree about that. That, anytime, I know it's a religious holiday, people are tempted, they want to get together, but, that's where the asymptomatic people, they don't know they're sick, but somebody next to them could be vulnerable and they can pick up the illness. And then, the 2 weeks that we work very hard in preventing this, you'll start seeing a surge, a so-called peak there. So, it is tough. Easter is meant to be for gatherings, but, I think health and everyone's well-being and the community safety takes precedence.
Right. We have another question that came in, and it's just about the fairly low numbers in Fort Worth as far as cases reported, and also deaths as well. Do you, just from what you guys have been observing as physicians, does it seem like, at least in Fort Worth, have we been doing a better job at social distancing, or do you just think that it may so have more to do with just testing and how difficult it might be to actually get tested for COVID-19?
Prescott, I think it's a little bit of both. I do think Fort Worth is doing a good job of social distancing, but I also can absolutely say from my own personal practice that those numbers are lower than what they actually are, and that's for a lot of reasons. But it is true that we're not testing as much initially. We've been able to ramp that up, as we've needed to. But those numbers are definitely lower than what they really are, both for cases and for deaths.
Yeah, that's very true. Usually when you see lower numbers, it goes both ways. One, there are fewer cases, people are doing their part in terms of social distancing, but also how easily can we access testing, and, that was the main thing. And, just looking back, actually it was last month, somebody asked me about New York City, about, we're seeing all these cases in Washington State in the nursing home. Why not in a big city like New York City, which is densely populated? And, one thing is maybe they're not testing enough. The test is relatively new. Why they're focusing on Washington is because there was one suspected person with COVID-19, and now it's in the nursing home. So the C time was focusing its efforts on getting the folks tested up there. Meanwhile, in New York City, cases are going up. It's a densely populated city. People probably did not adhere to social distancing as they should have early on, and that's why they've seen a surge.
Right. And so as far as just helping us all understand, wanting to see the numbers start to come down, right? I heard Dr. Fauci talk about you're always kind of sort of 2 weeks behind as far as your information in real time. So is that something you guys could just elaborate on for our viewers and everybody watching about that 2 week lag, and understanding that when we do start to see a decrease, it is more than likely because of what we have done 2 weeks or 3 weeks prior?
Exactly. That's exactly what Dr. Fauci has said. And, first of all, everything that he has mentioned is right on. we have to be better prepared in advance. We cannot expect, okay, we'll be prepared when the storm comes, because if that storm comes, it's too late. You want to be prepared before that storm sets in place. And that's why, working with our supply chain, making sure we have enough PPE in the hospital, making sure that we have enough ventilators, beds. You want to have all that in place before the storm hits. And that's why you want to be prepared. At least there is that lag, 2 to 3 weeks. But what can you do to prepare?
Right. All right. Well, this has been a great conversation. I appreciate you both for joining us today. And that'll do it for the Our Doctors versus the Internet live chat today. Thank you again, Dr. Luke, and thank you again, Dr. Bayani.
Thank you very much.
Thanks, Prescott.
All right. We appreciate you guys taking the time out of your busy schedules to join us for this important conversation about emergency room visits and COVID-19. Now, make sure you guys stick with us, because next week we'll be having another conversation on Thursday, April 16th at 1 p.m. And this chat will be how to care for people who have COVID-19. And also we'll talk in depth about at-risk populations, especially in the Fort Worth area. So stick with us and check back with us next week. We want to thank you for being a part of the live chat, and we will see you all. Thanks for watching.
Thank you.
Thank you.